Part A. Extract 1. Questions 1 to 12. You hear a gynecologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mrs. Mihiraa. Please come in and have a seat.
Good morning, Dr. Sharma. Thank you for seeing me so soon.
Of course, Mrs. Mihiraa. Now, you mentioned something urgent on the phone. Can you tell me what brings you in today?
I got scared as I am in the 32nd week of pregnancy, and I've been experiencing some worrying symptoms lately. That's why I booked the appointment urgently.
I understand. Can you tell me more about these symptoms?
Well, it all started about a week ago. I've been experiencing these terrible headaches that won't seem to go away. They're throbbing, and sometimes I even feel like I'm losing my vision for a few seconds.
I see. Have you noticed any other symptoms?
Yes, actually, my hands and feet have been swollen quite a bit, especially in the mornings. And yesterday, I had this strange episode where I felt really confused and dizzy, like I was about to faint.
I see. Those are certainly concerning symptoms, Mrs. Mihiraa. These symptoms could be indicative of several conditions, and some of them could potentially indicate serious complications during pregnancy. To get a clearer picture, I'll need to ask you some more questions.
Okay, please do.
Firstly, do you have any pre-existing medical conditions?
No, I've always been healthy.
Have you had your blood pressure checked recently?
No, not in a while. But my mom has high blood pressure, so I should probably get that done, right?
Absolutely. Now, I need to ask you a few more questions about your medical history. Have you ever experienced any seizures before?
No, never.
And are you taking any medications currently?
Just prenatal vitamins.
I see. Have you noticed any other changes, like increased urination or abdominal pain?
Now that you mention it, yes, I've been needing to go to the toilet more often. Occasionally, my abdomen experiences a sensation of tightness and discomfort.
And do you have any known allergies to any medications?
No, I'm not allergic to anything.
Thank you. Mrs. Mihiraa, your symptoms, coupled with your pregnancy, raise some concerns. I suspect you might have eclampsia, a severe form with potentially life-threatening complications for both you and the baby.
Oh my God, that's terrible. What do we do now?
Don't worry, Mrs. Mihiraa. We'll need to run some tests to confirm the diagnosis. I'll order blood tests to check your blood pressure, protein levels, and platelet count. We might also need a urine test and an ultrasound to assess the baby's well-being.
Okay, I'm willing to do whatever it takes.
That's good to hear. Depending on the test results, we'll discuss the best course of treatment. In the meantime, it's crucial to rest and avoid strenuous activity.
Thank you so much, Dr. Lee. I feel much better knowing we have a plan.
We'll get through this together, Mrs. Mihiraa. I'll see you again as soon as we have the test results. In the meantime, don't hesitate to call me if you experience any worsening symptoms.
Thank you again, Dr. Lee. I'll do that.
Extract 2. Questions 13 to 24. You hear a pulmonologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Kovac Heinberg. Please, have a seat. Good morning, doctor. Thank you for seeing me today. You're welcome. Now, tell me, what brings you in today? Well, I've had a lingering cough for the past few weeks, and it's starting to worry me. I see. How would you describe the cough itself? Is it dry or productive, meaning does it bring up any phlegm? It's mostly dry, but sometimes I do cough up some blood-tinged mucus. That's what really scares me. I understand your concern. And how does it feel when you cough? I get these occasional dull aches in my chest, especially when I cough. And sometimes, I feel short of breath after even mild exertion. I understand. Have you experienced any other symptoms alongside the cough and blood? Well, I've been feeling a bit run down, some fatigue. Have you tried any remedies for the cough? I've been taking some over-the-counter cough suppressants, but they haven't made much difference. And I was worried about taking antibiotics without a proper diagnosis. Alright, Mihiraa. Let's delve into your medical history a bit. Do you have any pre-existing conditions or have you been diagnosed with any respiratory issues before? No, I've generally been healthy. I did have a bout of pneumonia a few years ago, but that cleared up completely. Excellent. Do you have any known allergies to food or medications? No allergies or sensitivities that I'm aware of. Very well. Based on your symptoms and history, I suspect we need to rule out some potential causes for the cough and the blood in your phlegm. To get a clearer picture, I'd like to order some tests, including a chest X-ray and sputum culture. Okay, that sounds good. I just want to get to the bottom of this as soon as possible. Absolutely. Additionally, I'll recommend a complete blood count to check for any underlying infections. Alright. Meanwhile, I'd advise you to get plenty of rest, drink fluids to keep your phlegm loose, and avoid smoking or exposure to secondhand smoke if applicable. Until we receive the test results and determine the precise cause, I can prescribe a bronchodilator to help ease the coughing. Thank you so much, Dr. Kovac Heinberg. I feel much calmer knowing I'm taking the right steps. You're welcome, Mihiraa. Please return in a week's time with the test results, or immediately if symptoms exacerbate, and we can discuss the diagnosis and further treatment options then.
That is the end of Part A. Now, look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a gynecologist explaining eclampsia to a patient called Mihiraa. Now read the question.
Mihiraa, I have your test results. Unfortunately, they confirm our initial suspicion, you have eclampsia.
Eclampsia? But I'm only 24 weeks pregnant. Isn't that too early?
It can be, but eclampsia, while rare, is unpredictable. Your blood pressure is dangerously high, and the protein levels in your urine are concerning. These are both classic signs.
But what does this mean for me? For the baby?
The good news is, we caught it early. This gives us options. The immediate priority is to stabilize your blood pressure and prevent further seizures. We'll need to closely monitor you and the baby.
Seizures? I haven't had any.
Not yet, but eclampsia can progress quickly. That's why we'll be keeping you here for observation for the next 24 hours. Depending on how you respond, we might consider delivering the baby early to prevent further complications.
Deliver the baby so soon? But he's so tiny.
I understand your concerns, Mihiraa. We'll weigh the risks and benefits carefully. Your and your baby's health are our top priorities.
Now look at question 26. You hear a pulmonologist talking to a patient called Mihiraa regarding her diagnosis, hemoptysis. Now read the question.
Mihiraa, I'm afraid your X-ray and symptoms point towards hemoptysis, the coughing up of blood.
But I haven't coughed up any blood. I just have this persistent cough and some chest tightness.
Hemoptysis can sometimes manifest as blood-tinged sputum or streaks in the mucus, not necessarily bright red blood. Tell me more about this cough. When did it start? Is it dry or productive?
It started a few weeks ago after a bad cold. It's mostly dry, but sometimes I bring up some white phlegm.
I see. Your X-ray shows some scarring in the upper lobes of your lungs, which could be consistent with a past infection or something else. We need to rule out other possibilities like pulmonary embolism or even lung cancer.
Lung cancer? But I'm young, I don't smoke.
I understand your concern, Mihiraa. While lung cancer is less likely in your age group, it's still crucial to rule it out. We'll run some further tests, including blood work and a CT scan, to get a clearer picture.
Now look at question 27. You hear a head nurse talking to a nurse about a patient Mihiraa's eclampsia. Now read the question.
Have we confirmed the gestational age for Mihiraa? Her fundal height seems a bit off.
Ultrasound scheduled for first thing tomorrow, Annie. Dr. Hugh mentioned a possible discrepancy based on fetal movement.
Right. Mihiraa's BP is still borderline, despite the magnesium. Did we check for proteinuria again?
Just came back. Elevated again. I prepped another dose of hydralazine, just in case.
Good. We need to keep that pressure down. Have we spoken to the neonatal team about NICU availability?
Spoke to Dr. Lee. They're ready at 24 weeks, but they're pushing for later if possible. Every day counts for lung development.
I understand. But with the proteinuria and borderline BP, we can't risk waiting too long. Mihiraa's starting to show signs of preeclampsia progression.
Now look at question 28. You hear a morning meeting addressing patient care. Now read the question.
I'm deeply concerned about the spike in Ms. Mihiraa's blood pressure yesterday. According to the log, Nurse Sarah was on break during that time. Did anyone else check on her vitals?
Dr. Skyder, I've investigated. Sarah informed Nurse Ben about the rising pressure, but Ben was assisting with an emergency airway procedure at the time. He delegated the check to Nurse Annie, who, unfortunately, had a personal emergency and stepped out briefly.
3 missed checks? In a high-risk patient like Ms. Mihiraa? This is unacceptable. We have protocols in place for such situations.
I understand, Dr. Skyder. We're reviewing the protocols and implementing stricter communication measures. We'll also have a dedicated shadow nurse for Ms. Mihiraa until her condition stabilizes.
I expect a full report on this incident by the end of the day. Ms. Mihiraa's well-being is our top priority.
Now look at question 29. You hear a physiotherapist talking to a patient called Mihiraa. Now read the question.
Mihiraa, how are you feeling today? Your cough.
It's still there, Race. And there was some blood again this morning.
I understand, Mihiraa. But remember, managing your breathing and posture can significantly reduce coughing and irritation. Have you been practicing the deep breathing exercises I showed you?
I haven't been able to focus much. I'm worried about the tests, the results. What if it's...
I know it's scary, Mihiraa. But focusing on your well-being now is crucial. Deep breathing not only helps with the cough, but it also calms your nerves. And regular postural exercises can improve lung function and drainage.
See, each controlled breath takes the edge off that cough. And with good posture, your lungs have more space to expand, making breathing easier. Remember, taking care of yourself physically can also help you tackle those anxieties mentally.
Now look at question 30. You hear a pharmacist talking to a patient called Mihiraa. Now read the question. This is the Symbicort inhaler your doctor prescribed, Mihiraa. It's a combination medication for your cough and breathing difficulties.
But I don't have asthma. My doctor said it's something called hemoptysis.
You're right, Mihiraa. Symbicort isn't typically used for hemoptysis itself. However, in your case, it can serve multiple purposes.
Multiple purposes? How so?
While the cause of your hemoptysis is being investigated, this inhaler can help with two things. Firstly, it contains a steroid component that reduces inflammation in your airways, which can potentially lessen irritation and coughing. Secondly, the bronchodilator component opens up your airways, making breathing easier, especially if your hemoptysis is linked to any underlying lung conditions.
I see. So, it's not just for asthma, but it can still help with my specific situation.
Exactly, Mihiraa. Remember, your doctor knows your case best. This is just one piece of the puzzle, but it can play a supportive role in your overall management. That is the end of Part B. Now, look at Part C. Part C. Extract 1. Questions 31 to 36. You hear an interview between gynecologist Mihiraa and an interviewer on the gynecologist's experience in treating eclampsia. You now have 90 seconds to read questions 31 to 36.
Good afternoon, Dr. Mihiraa. Thank you for joining us today. To begin, could you explain what eclampsia is from your perspective as a gynecologist?
Good afternoon. Eclampsia is a severe complication of pregnancy characterized by the onset of seizures in a woman who has developed preeclampsia. Preeclampsia itself is a condition that typically arises after the 20th week of pregnancy and is marked by high blood pressure along with signs of damage to other organ systems, most commonly the liver and kidneys. Eclampsia is essentially the escalation of preeclampsia to a more critical stage where seizures occur, posing significant risks to both the mother and the unborn child.
Dr. Mihiraa, are there different types of eclampsia that you encounter in your practice?
In my practice, encountering various manifestations of eclampsia is not uncommon. One significant classification distinguishes between early onset and late onset eclampsia, each presenting unique challenges and considerations. Early onset eclampsia occurs before 34 weeks of gestation, and it often indicates a more severe and rapidly progressing form of the condition. Late onset eclampsia occurs after 34 weeks, and while it can still be severe, it tends to have a slightly better prognosis for both the mother and the baby.
It would be great if you could share an example, Mihiraa. An example of a patient you've treated for eclampsia?
Certainly. I once had a patient, Sarah, who was in her 28th week of pregnancy when she developed preeclampsia, which eventually escalated to eclampsia. Sarah had previously been healthy throughout her pregnancy, and her blood pressure had been normal up until that point. The sudden onset of seizures prompted immediate intervention, and we had to carefully monitor her to ensure the safety of both her and the baby.
How about a recurring patient? Have you had cases, Mihiraa, where the same patient experienced eclampsia in subsequent pregnancies?
Certainly. I've encountered instances of recurring eclampsia. There was a patient, Emily, who had experienced eclampsia in her first pregnancy. Despite close monitoring and preventive measures in her subsequent pregnancies, she unfortunately developed eclampsia again. Recurrent cases pose additional challenges as we must consider the underlying factors that make certain individuals more prone to this severe complication. Managing recurrent eclampsia requires a personalized and vigilant approach to address the unique risk factors and potential complications that may arise in each subsequent pregnancy. This underscores the importance of individualized care and continuous research to enhance our understanding of the complexities surrounding recurrent eclampsia.
Have you faced any cases where your treatment did not yield the desired outcome, Mihiraa, a failed case so to speak?
Unfortunately, yes. There was a case where despite our best efforts, the condition of the patient, Isabel, deteriorated rapidly. Isabel had both early-onset preeclampsia and eclampsia, and despite aggressive medical management, including anticonvulsant medications and blood pressure control, she eventually succumbed to complications. Failed cases like these are always emotionally challenging for the entire medical team.
I extend my heartfelt empathy to you and the entire medical team for the emotionally challenging cases like that of Isabel. Well, are there genetic factors that contribute to the development of eclampsia, even in some cases, Mihiraa?
Genetic factors can play a role in predisposing individuals to preeclampsia and, consequently, eclampsia. Women with a family history of these conditions may be at a higher risk. Additionally, certain genetic variations related to blood clotting and immune response have been associated with an increased susceptibility to preeclampsia. However, it's important to note that the interplay of genetics and environmental factors is complex, and not all cases can be attributed solely to genetic predisposition.
That's even challenging. Well, Mihiraa, let's delve into the treatments for eclampsia. What are the approaches you typically employ?
The management of eclampsia is multifaceted. First and foremost, we focus on stabilizing the patient. Controlling seizures with anticonvulsant medications is a priority. Simultaneously, we work on managing high blood pressure using medications such as magnesium sulfate. Close monitoring of vital signs, organ function, and fetal well-being is crucial. In severe cases, delivery may be expedited to prevent further complications.
Can you elaborate on the complexities, Mihiraa, that are involved in the treatment process?
Certainly. The challenge lies in finding a delicate balance. On one hand, we need to control the immediate threats like seizures and high blood pressure. On the other hand, we must consider the gestational age of the fetus. In some cases, delivering the baby is the most effective way to alleviate the condition, but preterm births come with their own set of complications. It's a delicate dance of managing the health of both the mother and the unborn child.
Now look at Extract 2. Questions 37 to 42. You hear a pulmonologist talking about a case study conducted on hemoptysis at the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
Good afternoon, ladies and gentlemen. I appreciate your presence here today at the Mihiraa Research Center as we delve into a fascinating case study on hemoptysis. My name is Dr. Honey Redfield, a pulmonologist, and I am excited to share some intriguing insights with you. Hemoptysis is a clinical term referring to the coughing up of blood or bloody sputum. From a pulmonologist's perspective, it serves as a vital diagnostic clue and can be a symptom of various underlying conditions. While it is crucial to decipher the cause behind this alarming symptom, it is equally essential to understand that not all cases of hemoptysis signify life-threatening conditions. The challenge lies in discerning between benign causes and potentially serious pulmonary issues. Sampling is a critical aspect, especially at the Mihiraa Research Center. It's critical for research methodology, shaping the representativeness of data collection, and playing a pivotal role in ensuring the generalizability and reliability of study findings. Our case study at the Mihiraa Research Center involved a meticulous sampling strategy to ensure a comprehensive understanding of the patient's medical history, environmental exposures, and genetic predispositions. The sampling methodology was designed to capture a snapshot of the patient's life, considering factors such as occupational hazards, smoking history, and exposure to pollutants. This holistic approach allows us to navigate through the intricate web of potential triggers for hemoptysis. Understanding the patient's socioeconomic background and lifestyle choices also played a pivotal role in our sampling. This comprehensive data collection is crucial to tailor an effective treatment plan that not only addresses the immediate concern of hemoptysis, but also factors in the patient's overall well-being. The study at the Mihiraa Research Center chose hemoptysis for its clinical importance, delving into the complexities of its underlying causes and contributing factors. Hemoptysis, often dismissed as a mere symptom, serves as a complex diagnostic puzzle. It is not merely the presence of blood in the sputum. It is a red flag demanding our attention. This seemingly simple manifestation could be an early indicator of serious pulmonary diseases, ranging from infectious causes like tuberculosis to more sinister possibilities such as lung cancer. Therefore, understanding why hemoptysis occurs is paramount to unraveling the mysteries of the patient's respiratory health. Moreover, hemoptysis may also be linked to non-pulmonary conditions like coagulopathies or cardiovascular issues, underscoring the importance of a holistic diagnostic approach. Delving into the patient's medical history, conducting thorough physical examinations, and collaborating with specialists across multiple disciplines contribute to a comprehensive understanding of the intricate factors influencing hemoptysis and guide a more nuanced and effective treatment strategy. Understanding how treatment interventions impact the occurrence and severity of hemoptysis is crucial for developing effective management strategies and improving patient outcomes. According to research at the Mihiraa Research Center, the treatment approach varies significantly based on the underlying cause of hemoptysis. In infectious cases, antibiotics may be administered to combat bacterial infections, while antifungal medications might be necessary for fungal infections. For non-infectious causes such as pulmonary embolism or bronchiectasis, a targeted therapeutic plan is essential. In cases where hemoptysis is a symptom of a more serious condition like lung cancer, treatment becomes more complex. Surgery, chemotherapy, and radiation therapy may be part of a multidisciplinary approach. The challenge lies not only in stopping the immediate bleeding, but also in addressing the root cause to prevent recurrence. The significance of treating hemoptysis extends beyond the immediate concern of blood in the sputum. Unchecked, it can lead to severe complications such as respiratory failure, anemia, and even death. Moreover, the study at the Mihiraa Research Center shows that hemoptysis can serve as a warning sign for conditions that, if identified and treated early, can significantly improve the patient's prognosis. The psychological impact of hemoptysis should not be underestimated either. Patients often experience heightened anxiety and fear, further emphasizing the importance of a compassionate and comprehensive treatment approach. In our case study at the Mihiraa Research Center, the patient's hemoptysis was linked to an unusual autoimmune disorder affecting the respiratory system, causing inflammation of blood vessels in the lungs and upper respiratory tract. Our team implemented a combination of immunosuppressive medications and supportive care, resulting in a notable reduction in hemoptysis episodes and an overall improvement in the patient's quality of life. Furthermore, regular monitoring and adjustments to the treatment plan were crucial in maintaining the patient's stability and preventing relapses. The successful outcome underscores the significance of a multidisciplinary approach in managing complex autoimmune conditions impacting respiratory health.
That is the end of this listening test. Now, check the answers.